Health Watch today, we have a new study from Mount Sinai shining light on COVID-19 vaccine immunity. The research found that antibody response from those vaccines are long-lasting instead of short-term. Joining us now to discuss is Koma Srivastava, Director of Strategy and Operations at Mount Sinai Center for Vaccine Research and Pandemic Preparation. Welcome.
Thank you so much. I'm honored to be here.
Can you talk about what inspired this research and what makes this study different from others done on this topic?
Absolutely. So our research team here specializes in how to understand viral infections, vaccines, and their impact on the human immune system. One of the ways we do this is by measuring antibodies, the protein in your blood that helps your immune system fight viruses. If I could take us all back to 4 years ago, when New York was an epicenter for the COVID-19 pandemic, and there was limited resources for testing, for understanding how the virus worked. Our two lead scientists, Dr. Viviana Simon and Florian Kramer, developed and invented an antibody test that not only confirms whether someone is making antibodies against SARS-CoV-2, the virus causing COVID-19, but also gives a measurable score as to how these antibodies are tracking how many are being made. We started the Paris study to learn exactly how long these antibodies last, not just in the short term, but over the course of years. So we enrolled healthcare workers from the beginning of 2020 up till the current day. And we track antibodies on a monthly basis with additional visits if somebody reports a new vaccine or infection. The paper that we published covers this study's work over the first 3 years, spanning 8,000 visits from 500 participants.
When the study says that vaccines' effects are long-lasting, what does that mean for people? How long are you talking?
Well, because our study has been going on for years, we were able to measure the antibody response from the primary vaccines all the way till people got their boosters, averaging from 8 months to over a year out from their first vaccine dose to the third. And we saw the antibodies never decayed to the point where they were no longer measurable. The vaccines were really effective in producing a high jump in antibody production in the onset, and then over 6 to 8 months, they fall to a very steady but strong state. The boosters and the new vaccines are really important in terms of making sure that antibody production stays high, but it's not true that people lose their antibodies within 2 months of getting their shot. They stay on for months and months.
What surprised you the most about these findings?
Well, we were shocked at the supreme efficacy of the vaccines themselves, and we were also shocked by how quickly the virus changes. So thanks to the fact that the study started before the vaccines rolled out at the end of 2020, we were able to measure vaccines' impact on antibodies before and after the primary series and up until boosters. And we saw that people who had COVID before the vaccines first came out had a stronger antibody response, and that the booster vaccines did a lot in making sure that people, no matter of their infection history, had the same strong antibody response. The other surprising factor was when we saw COVID changing and the different variants coming out. Before Omicron, in our highly vaccinated group, there were little to no breakthrough infections. We had no breakthrough infections in people that already had COVID. But after Omicron and the virus changing dramatically, we saw breakthrough infections skyrocket in our study in people with and without prior history of COVID, which made it really important for us to underscore how the current vaccines are very effective for the current variants, and it's important to stay up to date with that.
And how do you anticipate the study will help with COVID fatigue?
Anecdotally, a lot of people say that COVID is like the cold or like the flu, but we know that that's not the case. There are many people who have gotten COVID in the past and are still experiencing symptoms weeks, months, even years after the fact. Many of our participants also have this experience. So we're hard at work at investigating it, and we hope that our study findings are going to provide reassurance and insight as we give a behind-the-scenes look at how your immune systems work in healthy adults before and after different vaccines and breakthrough infections. I can't emphasize enough that people who are experiencing this and would like to participate in research, we welcome support from the public in finding this. It's only thanks to people like you reporting their experiences, sharing their stories, and sharing their information that we're able to know what we do.
Koma Srivastava, Director of Strategy and Operation of the Mount Sinai Center for Vaccine Research and Pandemic Preparedness. We thank you.
Thank you so much.